Today, we have RingCentral to discuss AI-powered tools for calling, messaging, and meetings. Welcome.
Thank you. Good morning, good afternoon. Again, Preston, Regional Manager with RingCentral, here along with Sam Miller and Ken Blanc. Sam Miller is one of our Senior Account Managers for the healthcare vertical, and Ken Blanc is one of our Senior Solution Engineers. Thank you for having us join today. Before we really dig into the slides and the discussion today, just wanted to highlight a few of the current partner promotional spiffs that are running right now. We have a 6x spiff going for our UC, our EX, with at least a 3-year term. It bumps up to a 12 times spiff when there is a CX, Ring CX component to it. Amazing spiffs going on. That's running until the end of this month, and then there'll be some new spiffs rolling out for the back half of 2026. We're going to get into another promotional spiff for AIR, or AI Receptionist, so the partner that sells the most. AI Receptionist has the ability to earn $50,000 as a promotional spiff. So I'm going to talk a little bit about a national restaurant chain that RingCentral is one of RingCentral's customers. And the story around it is, like most RingCentral customers maybe signed up during the pandemic or pre-pandemic, a lot of them were just solving a business need for just your standardized UC needs, just voice components only. This national chain rolled it out to a number of their restaurants back in 2023 and has grown with RingCentral as our technology stack has grown. There were pretty decent expansion of their services in 2024. And as RingCentral has polished up and been pushing out our Ring CX, a number of our AI solutions for AIR and ACE. ACE is our conversational analysis expert, a post-call recap, as well as some dashboards that are very, very helpful for the business analytics. We've seen substantial growth in this. And why I wanted to tell this story is y'all maybe have some RingCentral customers that you sold to, or maybe some prospective customers that have some RingCentral services that you're getting strategic with. And I wanted to mention that there is an upsell spiff associated for those organizations that don't have Ring CX or AIR or ACE and some of the other newer technologies that we're going to market with, for which you guys could capitalize on getting some upfront spiffs on already existing accounts of yours. So really nice growth that's happening not only with this national restaurant chain, but a multitude of different organizations out there that are growing their technology stack as RingCentral continues to develop and serve their business needs. So as we're thinking about this today, you're going to see on this next slide just so many different pieces of the technology rainbow that RingCentral is really going to market with. You'll see various different verticals. RingCentral is really concentrating on the legal, the public sector, retail, healthcare, financial services. We're getting strategic in the automotive. I was just talking to a colleague today. I think one of our larger automotive dealerships is, over 30,000 phones that we've rolled out nationwide, and then real estate, of course. But whenever you think about this, we're never just leading in with the product with customers. We're thinking on how we're going to solve their issues or solutions that we can bring to them that are going to positively impact their business. There's so many acronyms and so many different things going on with RingCentral, but I wanted to show this, that RingCentral is really developing our solution stack to be all encompassing for not only the employee experience, but the customer experience, and having a lot of AI servicing our platform to provide more efficiency gains for all involved. And, love this quote that was mentioned by Dave McClure: customers don't care about your solution, they care about their problems, right? So as we all know, let's get back down to the foundational discussions with the clients, talk about them, solve what they're looking to solve for. If they don't know, the issues that they may be occurring, let's get in with some open-ended questions to uncover that. I'll follow up post call with some really helpful open-ended discussion questions for the various different technologies that we're going to market with and the various different personas that we can be having those conversations with. Some of the things that our global sales trainer, he wasn't able to make it today, but he's pulled out and has extracted by polling a number of our partners as well as various different sales leaders, some of the key things that are kind of standing out as customers are looking for new solutions today. And just wanted to flash these up on the screen. Some of them are just really just inefficiencies within their workplace, can't stay connected, reliability issues, really ability to drive positive revenue gains or retaining customers kind of stand out amongst the pack. But I'm sure this is very, very common and similar to the experiences that you're going through, but trends are staying consistent, and businesses are really looking for finding technologies that are going to provide more benefit for them. But without further ado, I wanted to get Sam Miller, one of our senior healthcare account executives, like I mentioned before. He's living and breathing in this vertical. He's one of our specialists. He loves working with the partner community. So, Sam, if you don't mind, give a quick
Yeah,
introduction of yourself, and let's get into a little bit of healthcare discussion.
yeah. Thanks, Preston. Appreciate the opportunity here. So, Sam Miller, RingCentral Healthcare Account Executive, been with RingCentral for 8 years now, and 4 of those have been in the healthcare vertical specifically. So, I am tasked with talking to providers, payers, medical device manufacturers who are looking to make a switch into the cloud and working with our existing customers. And going back to the slide that Preston provided earlier, a lot of the problems in healthcare are very nuanced. And so we've developed a healthcare focused team from solutions engineering to an industry principal who's a former CIO at Delta Dental to really guide our healthcare vertical into building out some of these specific workflow tracks and then specific integrations. I saw there was a question in the chat, which we'll definitely talk about integrations in the healthcare space and how we're accomplishing that. But really, the charter that we have been given here as a healthcare team is to not just be a UCaaS or CCaaS provider, but a healthcare solutions provider and enable those communication paths for patient and provider communication, regardless of modality or location. So the 3 areas that we really focus on when getting into those customer issue or customer problem discussions are around patient engagement. Healthcare has taken on a much more concierge approach over the last few years, where if you don't know who your patient is or if you don't know something about them, you're behind already. And that personalized care is being infused across every subvertical, whether it's orthopedic, physical therapy, dermatology, the different nuances that come with providing care in your subvertical must have some sort of connection point with the patient. You have to know your patient. Then beyond that, remote health and telehealth has emerged as a very popular access to care, especially in rural health areas. So one of the main focus groups of our team this year and for the next 4 years is really going to be around the rural health transformation that the Center for Medicaid Services has rolled out. So if you're unaware, quick overview is $50 million provided to rural health providers with HR1. And so the goals of this rural health transformation act for the next 5 years is going to be around tech innovation, around sustainable access to care for rural health providers. And so that $50 billion is going to go to each individual state, and states have their own requirements, but our technology is able to provide some of the access to care capabilities that rural health providers are maybe lacking or maybe just need to upgrade their infrastructure around. So big area of focus here when we talk about connecting outcomes to areas where funding is provided. And then point of care workflow, improving access to care and connecting teams from intake to scheduling to billing and everywhere in between throughout the revenue cycle management process. So these are the main areas where we talk about trying to solve customer issues creatively with our solution. Next slide. And then in every conversation, AI is obviously front of mind. So in the healthcare space, a lot of what we see as that first barrier of entry into AI is around ambient listening. So providers using an ambient AI solution to take notes and chart that into a patient's profile. And so whether it's their EMR, if they're using Epic or Cerner, eClinicalWorks, this goes back to knowing your customer. And so that's an area where we see being a stepping stone to get into the conversational AI conversation. So intake and pre-visit, this is about surfacing all of that information that you already have about your existing patients. And then we have the ability to automate that scheduling process. So in healthcare, about 40% of calls are appointment scheduling, 20% are billing questions. And so those two categories, and then you add in 20% for prescription refills, get you about 80% of your conversations with a healthcare provider. And if we can say, look, we can automate 80% of your conversations, whether it's appointment scheduling, billing questions, or prescription refills, that suddenly creates a very large ROI. And the goal when we talk about AI capabilities within the platform and within healthcare, it's not necessarily to replace humans, but it's allowing that shift for your people to focus on high priority conversations with patients. So that's really the story that we tell in AI around pre-visit. And then during this goes hand in hand with care coordination. I mentioned ambient listening earlier, to allow providers to focus on giving a level of care. And then post-visit, proactive care follow-up, one of the biggest areas that we find value for healthcare providers is reducing readmission rates. Because that has a financial impact. If a patient is discharged and then they're readmitted to the same facility, they're dinged on that as a provider, and it can hurt their scores and reimbursement rates. And so preventing readmission is massive, and we look at an omni-channel approach here in order to help curb that as much as possible. So those are just a few of the use cases. I think talking through some of the areas where we're seeing success in subverticals is probably important as well. I mentioned rural health transformation. Regional hospitals is an area where we're seeing a lot of movement, as well as behavioral health, mental health providers, substance abuse, addiction programs. Seeing a lot of positive movement in that space, as there's a lot of antiquated technology, and the point of care has changed, as we mentioned, with telehealth, with SMS, being able to provide multiple methods of communication and entries into the provider network. We've seen a lot of positive movement there. So as mentioned, there was a question on integration capabilities. I think I cover that in the next slide here. And I think this gives a good overview of some of the partner ecosystem specifics that we've been able to create in the healthcare vertical. So Preston, if you want to go to this last slide, be great.
And before we jump into that, right? And I know you're talking through some great pre-visit, during, post-visit, and this comes up quite a bit from the partners that I serve and work with. What about like physical devices from a communications perspective? Are you still seeing a heavy adoption from a physical phone, a headset like you're wearing today, other devices that maybe need to be connected into a RingCentral type service? as well as maybe what we're seeing in that disaster recovery, because a lot of the healthcares are like, I need to be going 24/7,
Mhm.
365. So before we get into the
Yeah,
integrations, maybe hit that a little bit.
absolutely. In healthcare, we see a pretty heavy footprint for physical devices. And in a lot of cases, you have individuals who are interacting with patients who are calling in on the phone, and they're working with someone who is physically in person at an office, whether they're checking in for an appointment or looking to schedule an appointment or maybe follow up from a recent appointment. And so there's a lot of movement in these clinical settings. And so we're seeing a shift to, instead of having a traditional physical handset, Wi-Fi enabled handsets have been extremely popular in clinical settings. Yealink and Poly both offer a really great model there, but it allows for that flexibility to move around an office, because sometimes you may be getting a fax referral off of a physical fax machine, or helping with a patient getting to their appointment. So a lot of movement, which then necessitates a mobile device, where the mobile application also comes into play, in a headset environment. So it goes back to the understanding of workflows and how does work get done within the different provider spaces. And we're seeing an emergence of more of this, in what I call an informal contact center. It's not traditional where you're answering calls nonstop. As mentioned, there's a lot of in-person interaction that takes place as well. And so being able to introduce more sophisticated routing capabilities or call flow logic that allows individuals to focus on the people in front of them, but we're not missing calls, because for a provider, a missed call could mean a missed appointment, which means missed revenue. And so the ROI is really going to be found around those appointment scheduling calls. The other area, Preston, that I think I have on the next slide as well, as it relates to devices too, is around like nurse call phones, nurse call systems, ASCOM, SpectraLink. The ability to integrate with those systems has been a requirement that we hear a lot in the hospital setting. And so, knowing that the physical devices are a higher cost item, any opportunity where we can utilize the devices in place and systems in place to shrink down on the change management is a perceived value add as well. So, again, this is the healthcare ecosystem. Physical devices, nurse call system, analog devices are definitely a part of that. You'll see here a number of other items. I think the area I wanted to focus on was around the EMR EHR. This goes back to knowing your patient, because a conversation can happen, but if it's not being memorialized within the EMR, what's the value of it? And so the efficiency gains here by being able to write back into a medical record system like an Epic or Meditech cannot be understated. It's a conversation that is coming up in every discussion that we have. Can you integrate with this? Can you integrate with our practice management software? So the way we go to market with this, SpinSci is a partner who first started on the Epic Marketplace and has since built out a number of integrations for things as basic as a screen pop of the patient record, so an agent knows who's calling in when they call in, all the way to a full IVA solution, an agentic solution that's scheduling appointments autonomously and then writing that back to the EMR. So the integration capabilities that SpinSci offers are pretty vast, and we have a number of successful deployments with multiple EMRs in the space there.
Sam, what would you suggest to the partner community that's on that took the time to join today, and those that will look at the recording later? Like, how should they go about, talking to a new prospective healthcare vertical customer? Like, what should they uncover first? Should it be the EMR? Should it be the appointment setting piece of it? Like,
Yep.
what are you seeing in all the conversations that you're having with our valued partners as well as the customers themselves?
Yeah, it's a good question. I think the area where you're going to find the most opportunity to make a positive change here for your customers is going to be around anything patient engagement or operations focused. Um, I think healthcare has gotten uh, the reputation of being slow to adopt technology. I think that's being flipped on its head now with AI, and the conversational AI capabilities. And so we're seeing that organizations are wanting to make changes. They're looking to leverage the conversational AI capabilities that now exist in order to improve workflows and operations. But it's having the conversations with the right folks. I think uh, organizations who have AI governance structures already set up are the ones that we're going to be able to deliver the most value. And I think understanding the entire ecosystem and how we can consolidate that is how I would approach a new healthcare customer. Consolidation is going to be key. And with the ecosystem that we have in place, we have the ability to be the aggregator in that conversation. So hopefully that's helpful. And digging into the nuances of the subvertical providers is something that we can definitely assist with.
No, that's great, Sam. And I know the partner community has been teased a little bit with something that's on this slide called Air Pro, but specifically Air Pro for healthcare. What are your thoughts? Where are things going? I know that's a lot of
Yeah,
the pre-intake stuff, but
yeah,
any opinions on that?
yeah. I think this is the area that every healthcare organization is going to have in some form or fashion in the next 3 years. Um, there are over 500 different agentic solution or IVA providers that are on the market today, which is staggering. And we see we actually had an exercise last week with our healthcare team to see how many competitors we've gone up against in the last 6 months, and the list was 28 different providers just in the healthcare vertical across 6 sellers. And so there are a number of providers that can book appointments autonomously and have the perceived same value here. So where I'm excited about Air Pro is the integration capabilities that we can leverage along the way, as well as connecting it with both the UCaaS solution and CCaaS solutions that are in place. So a lot of these providers are relying on third-party connections, third-party language models, and so the fact that we own the technology here and can develop it only allows us to advance it faster because of the input that we're receiving from customers. And I can tell you right now, healthcare is the biggest driver for AirPro. So I'm very excited for it and see the impact that it's going to have.
I love that, Sam. Thank you so much. And I know we only got about 5 more minutes, but I did have one more question for you.
Yeah.
What personas at these healthcare vertical specific organizations are getting involved, right? So that may be very helpful for the team that's listening in today. Like who is coming to the table in these discussions?
Yep. Certainly, IT is involved. So CIO, CTO, if they're leading the strategic pursuit of something like this, they're going to be involved at some point. But those operations titles that we see a lot are director of patient experience or patient outcomes, um, and sometimes health operations. So the operations titles are definitely the ones that are driving these initiatives with IT's involvement. That's what we would say on a case to case basis. It may vary, but for the majority of these pursuits, that's what we're seeing.
And I lied. I have one more question for you. Do you have a use case, a specific customer that stands out to you on why they selected
Yeah,
you, the partner that you maybe work with, RingCentral, because I'm sure they were evaluating multiple different solutions in
yeah.
your segment.
Yeah, it really comes back to consolidation. So I have a large medical imaging organization here in Colorado that selected us and is using us for really everything. And the reason being is single platform, single voice network, single support organization to consolidate everything they're doing. And they decide to build rather than buy a lot of their technology. So they built out their own EMR, and our ability to integrate with that, whether it's SMS blast or voice calls, and everything in between, was the reason they selected us, and tells a really good story that applies in a lot of the healthcare verticals.
That's great, Sam. And
Mhm.
Claris TDM team, we have a few minutes available for some questions. Post them in there. We're happy to address it. One last plug is, Sam mentioned some devices, but both Poly and Yealink have phenomenal devices on the market. We started actually having a line card for Poly headsets, similar to what Sam is wearing today. And we also have a cashback promo available to the customers that are purchasing or renting Poly devices, and that's going to be running until the end of July. So, and I know Sam, he loves working strategically with partners. So if there's any
I do.
opportunity, maybe you want to talk about the states that you cover, Sam, real quick. I don't think you mentioned
Yeah.
that.
So I don't know if I mentioned I'm based out of Denver, Colorado. So if anyone's local, would love to grab coffee or lunch. But then I cover the healthcare vertical from Utah all the way over to Wisconsin, Illinois, and everything north. So like the Mountain Midwest region is what I call it.
Sounds great. And, Sam's, a team lead's been doing it for a while. And, if there's a different state and market that y'all are targeting, we're happy to get you introduced to that senior healthcare account executive. And, Sam and his team are phenomenal. And this is considered a gold vertical for RingCentral. So there's a lot of investment that RingCentral is making to make sure that our healthcare vertical is top notch, and we can serve the partners the best that we can, as well as the customers that y'all are serving as well. So really looking forward to getting more strategic. We'd rather do this smarter than harder. So let's work together. Let's figure it out. Let's turn over some stones, and we'll make it happen.
What migration and onboarding support do you provide?
Yeah, I can take
Sounds.
that one.
Go ahead, Sam.
Yeah. So we have a full professional services organization that what we would do is we would scope out um, the full customer landscape, timelines, individuals who would be involved in the project, and then be able to provide a statement of work. We take more of a results-based approach for implementation and support. And so it's not a bucket of hours approach that some others might use. So that SOW and the project plan that we provide is really the guide along the way. The other thing I'll say for legacy on-prem providers, we have the ability to extract that data and then upload it into the RingCentral business requirements document. So that can cut down sometimes weeks of back and forth for gathering that information. So that's one of the benefits that we provide on the implementation side, and then named resources for support.
Okay, we have one more. What integrations are most valuable to customers?
I'm a little biased, but on the healthcare side, it's going to be the EMR, EHR platforms that we discussed. Then beyond that, your CRM tools, Salesforce is obviously the big one. And those would be a little bit outside of my vertical capabilities, but we have a number of pre-built integrations with the major CRMs, and then have an advanced solutions architect team that can build out custom integrations into anything like a homegrown CRM system.